Some Bay Area healthcare workers say that they're dealing with yet another round of coronavirus burnout.
KTVU's Asna Smith joins us now live in San Jose after talking with doctors there working to manage a surge of cases driven by the Delta variant. Asna.
Yes, Heather, doctors I spoke with say they were hopeful in the spring when vaccines were widely available. Now they're frustrated because they say these hospitalizations could have been avoided.
We're a lot like all the other humans who are tired of talking about COVID.
It has been an exhausting 18 months for doctors like Dr. Angela Rogers, who works in the intensive care unit at Stanford treating COVID patients. As she watches COVID cases climb once again at her hospital, she thinks about how it could have been prevented.
We don't have to be here. If everyone would trust the science and everyone who could get the vaccine medically would, then everyone would be protected. So it does feel harder and worse this time around.
Throughout the Bay Area, the number of people hospitalized with COVID-19 spiked dramatically shortly after the state reopened its economy.
We went from about 5 cases at the time of reopening per day to about 40 cases. So that's an 8 times increase. And we've been hovering at around 40 cases on an average day for the last month or so.
At UCSF, where Dr. Peter Chin Hong works, the hospital requested 200 traveling nurses to help with staffing. The hospital says, unfortunately, those nurses are in high demand elsewhere.
It just seems like a grind every day, in and out.
On Facebook, Regional Medical Center in San Jose posted a video of its healthcare workers and the pandemic's toll.
I think the biggest stress for me was the idea of taking anything home to my family.
And in some ways that was really scary, to be constantly faced with mortality.
There's just, I think, a deeper level of sadness this time that it's not just the virus, it's partly that we as a society didn't control it. And
Dr. Rogers of Stanford says the hardest part has been seeing her patients suffer with regret.
A lot of our patients, even when they started to get symptoms, would quickly go and get vaccinated as they started to feel ill, and that's definitely not advised.
And Dr. Rogers says it's not too late to get the vaccine. And with today's FDA approval of the Pfizer vaccine, she's hopeful more employers will insist on getting the shot. Heather?
All right, Asna Smith for reporting live for us tonight. Asna, thank you.